Okay, so it will be a little bit maybe not interesting because Daniela explained the thing that I also did. So, but it's pretty much similar. So my name is Maja Vukanovic, and I also find interesting to find out something about acupuncture and obesity. Let's say with the definition, obesity is actually chronic disease characterized by abnormal or excessive accumulation of body fat that present, of course, risk to health. Commonly, it is used body mass index to let's say calculate if you are in a risk for obesity. So for obesity, body mass index is 30 or higher, but it also depends from country to country. They have some different, for example, in Japan, if body mass index is more than 25, it is considered obesity. Body mass index is a simple calculation of person's weight in kilograms divided by their height in square meters. According to the World Health Organization, obesity is classified into three classes, as listed here. But what I want to mention in this slide is that it's important where this fat accumulates. Is it prevalently visceral or prevalently subcutaneous deposition of fat? Because if it's visceral adiposity, then the major risk for many metabolic complications are sure, while subcutaneous fat seems to be much more benign and even protective against the development of metabolic complication. We all know that obesity is a global problem due to, first of all, eating a lot of processed food and sugar. But these are some numbers that compares percentage of obesity in 1990 and in 2022. So it also rise from in adults from 25% to 43%, which is really huge percent. And also for children, in 1990, only 2% were considered obese. And in 2022, it is 8%, which is also much, much higher. I want to show on this diagram also this, but what I want to mention is that it is very important at what stage of life person becomes obese, because it can affect his ability to lose weight later in life. So persons who were obese as children can have great difficulty losing weight as adults because they have up to 5 times more fat cells. So in the childhood, if you get obese, then fat cells are more present than when you are adult. When you get obese as adult, because at that time only these fat cells that you already have, they are, let's say, getting bigger only, not multiplying. Of course, accumulation of excess body fat has negative effects on health, and obesity is a risk factor for many chronic disease. We know that diabetes is one of the most important, also heart disease, stroke, hypertension, osteoarthritis, and even carcinoma. Of course, we know in treating obesity in Western medicine, it's logical that many of the causes of being overweight and obese are preventable and reversible. All the other factors are involved. The fundamental cause of obesity is imbalance of calories consumed and calories expended. So lowering the risk includes diet, of course, reducing the number of calories, consume fats and sugar, avoid processed food, physical activity, engaging in regular exercises. That means that for children, it's recommended at least 60 minutes per day and 150 minutes per week for adults. Psychological support, because emotional overeating is really present. as a problem. Medical treatment, as Daniela also said, as well as surgical treatment are, let's say, they have a lot of negative effects. Also, it is interesting that in babies, studies have shown that exclusive breastfeeding from birth to 6 months of age reduces the risk of infants becoming overweight or obese. Sorry. Causes of obesity from a TCM perspective. In traditional Chinese medicine, TCM, good health consists of the body systems acting in harmony according to the individual's constitution. And if all is working well, there will not be any weight problem. What I like the most is that TCM takes a holistic approach to obesity by focusing on the underlying changes in the body. And according to TCM principles, development of obesity is due to the following pathological changes, which are individual. Some of the causes from TCM perspective are exogenous evils that give rise to obesity, stomach heat and poor spleen functioning because of overconsumption of heavy, greasy food, dampness and fat evils accumulates in middle burner, chi stagnation causes turbid phleg accumulation and damage of spleen, excessive internal phleg and dampness due to spleen deficiency, which is same, stagnation of chi and blood, yang deficiency of spleen and kidney essence exhaustion leads to disharmony, and liver stagnation. Acupuncture effects. Acupuncture complements is one of the complement treatment of obesity. Besides the things we mentioned as well in TCM, it is very important what we eat and if we are physically active. But some of the most important effects are analgesic effects, which is after acupuncture application, beta endorphin is one of the endogenous opioids that rises in plasma and affects metabolism. Also, stimulation of some specific points cause weight loss by controlling the feeling of hunger. In the book of Yellow Emperor, Internal Classics and Asian Meridian Theory Guide, the selection of combination of acupoints. This is also one slide about effectiveness of acupuncture in weight loss, that improving insulin responsiveness and preventing the progression of insulin resistance to type 2 diabetes in obese patients. Here we can see what is happening in obesity and what is the point of acupuncture. So acupuncture, after applying acupuncture, there is a reduction in inflammation and neuroendocrine balancing. So it affects downregulation, leptin and insulin resistance, ghrelin lowering and glucose metabolism improvement. Then also regulatory effects on hypothalamus, balancing hormones, and improvement of lipid metabolism. Also, it is very important to have a good macrobiota and gut-brain axis balance. Selection of points and selection of meridians and acupoints in TCM is individual. There is one sentence, Bian Zheng Lun Zi, I don't know if I pronounce it well, but it means that base treatment on the patient's personal pattern discrimination. Mainly the points are used on conception vessel meridian, spleen, stomach, kidney, bladder meridians, which are often selected as chief acupoints in the acupuncture of treating obesity, but we also add some different points depending on this harmony pattern. Okay, sorry, I didn't know that I turned on this thing. So we will wait. Like Daniela said, these are the 3 most important points, and I will just only mention because she really well explained them. So it's large intestine 4, stomach 36, and stomach 44. Okay, in this picture is stomach 31, but okay, it's a mistake. Also, we use, I will just say the points, which are NAG1, pericardium 6, Shenman, heart 7, Pucci, large intestine 11, Sanjiao 6, Ren 12, Ren 9, Ren 8, stomach 25, stomach 36, which is not here, bladder 13, bladder 20, liver 2, stomach 44, and gallbladder 43. Some points, they have special effect, and points for tranquility, if you miss one letter. Heart 7, then pericardium 6, then for sedation we use DO 20, for digestion stomach 25 and Tian Shu, spleen 9. Then we use Yinling 1, Ren 5, Shiman, Ren 9, Shui Fan, spleen 15. Okay. For fast metabolism, we use Sanjiao 8. For reduction of appetite, stomach 21. Diuretic point is kidney 3. Endocrine points are gallbladder 21 and large intestine 18. And as I mentioned, stomach 36 is a very important point for balancing qi and blood. Also, in treatment, when we use acupuncture, it is possible to use auricular acupoints, and most of treatments are also based on this kind of therapy. In this area, we use points that includes parts of large intestine, small intestine, lung, triple burner, subcortex, hunger center, thirst center, constipation center, sympathetic, stomach, esophagus, mouth, adrenal gland, and spleen. What is conclusion? Controlled studies aim to investigate the effects of acupuncture in treating obesity. They reported that the combination of medical nutrition therapy, exercise, and acupuncture is more effective than diet and exercising alone, and that acupuncture monotherapy or acupuncture exercise combination does not make a significant difference compared to exercise alone. But I think that acupuncture really has a greater effect than maybe this sentence is explained. But applying acupuncture evidently stimulates some anorexic hormones, inhibits some orexigenic hormones, and as a result suppresses appetite. And it is reported in literature that these effects of acupuncture are much more effective when applied together with the diet and the exercise. Yet there are still uncertainties about whether acupuncture practices alone are effective in treating obesity. So this is practically the same conclusion. Here is the reference in literature.